Hey everyone, today we're jumping into a skill that is absolutely fundamental for every single nursing student, assessing peripheral pulses. Think of this as your guide to not just doing the skill, but really understanding what it all means for your patient. Okay, let's get into it.
So, when you put your fingers on a patient's wrist, what's actually going on? It's so easy to think it's just about counting to 15 and multiplying by 4. But the story that pulse is telling you, it's so much deeper than that.
That's right. Every single beat is like a little message sent directly from the heart. It's giving you a real-time snapshot of their circulation and their overall cardiovascular status. Honestly, getting this assessment right is a huge step toward building that clinical judgment you're going to need.
So, here's our game plan. We'll start with why this skill matters so much, then we'll talk about getting prepared and focusing on patient safety. After that, we'll dive into the hands-on technique, learn what our findings actually mean, and wrap up with what to do when you get some unexpected results.
Okay, so first things first, let's lay the foundation. Why is this one skill so incredibly important in your day-to-day life as a nurse?
At its heart, no pun intended, assessing a peripheral pulse is how you check if blood is getting where it needs to go, from the heart all the way out to the fingers and toes. It's like a direct window into how well that whole circulatory system is working.
And for real, getting these foundational skills down cold is what's going to make you feel confident out on the floor. If you're finding this explainer helpful, do us a quick favor and hit that subscribe button for more videos just like this one.
All right, let's move on. A great assessment actually starts before you even walk into the patient's room. Seriously, preparation is key.
First, you've got to review the client's chart. Look for their history, any heart problems. Check their meds, are they on anything that might affect their heart rate? And find their last pulse reading so you have a baseline to compare to. Then, get your gear. You need a watch with a second hand, and you should always know where to grab a Doppler, just in case.
Now, let's talk about maybe the most important part of any skill, the patient. This is all about making a human connection while making sure every single safety check is ticked off. Look, these steps, they're totally non-negotiable. Always provide privacy. Introduce yourself. It helps build trust right away. Wash your hands. It's so simple, but so important. And this one's critical. Use 2 patient identifiers, like their name and birthday, to make sure you have the right person. And finally, just tell them what you're going to do. A quick explanation can make a world of difference for their anxiety.
Okay, we're prepped, we've connected with our patient, it's time to get to the hands-on part of the skill.
These are the big ones you've got to know. From the temporal pulse up on the head all the way down to the dorsalis pedis on the top of the foot. Each of these spots tells you something specific about blood flow. Yeah, the radial pulse on the wrist is the one you'll use most often, but you need to be comfortable finding all of them. Okay, stop and listen to this one, because it is a critical safety alert. I really can't say this enough. Never, ever press on both carotid arteries in the neck at the same time. You can actually cut off blood flow to the brain, which could make your patient dizzy or even pass out. It's always one side at a time, period. So once you've found the pulse, what are you actually assessing? It really comes down to these 4 things. The rate, which is just how fast it's going. The rhythm, is it steady like a drum beat or is it all over the place? The strength, how strong is that beat? And quality, which just means you're comparing, say, the left wrist to the right wrist to see if they feel the same.
And this is how we talk about strength. It's a simple scale, from 0 to 4+. 0 means you can't feel anything. 1+ is weak, 4+ is like super strong or bounding. The magic number, the one you're looking for, is 2+. That's considered normal. So you've collected all your data, the rate, the rhythm, the strength, the equality. What now? Now we have to figure out what it all means and put it together into a clinical picture.
For your typical healthy adult, this is the goalpost. You're looking for a rate somewhere between 60 and 100, a nice, steady rhythm, that 2+ strength we just talked about, and pulses that feel exactly the same on the left and right sides of the body.
But, and this is a huge but, what's normal changes a ton with age. Look at this.
A newborn's pulse can be screaming along at 160 beats per minute, and that's totally fine. You can see the expected range starts really high and then slowly comes down as kids get older. Remembering this is absolutely crucial.
You know, in nursing school, everything is perfect. But in the real world, you have to be ready for anything. So what do you do when your assessment doesn't look like the textbook? Okay, this happens to everyone, and it can be a little stressful. You're trying to find a pulse, maybe on a patient's foot, and you just can't feel it. What's your next move?
The answer is to grab a Doppler. This little machine is way more sensitive than your fingers. You'll put a little gel on the spot, place the probe over the area, and listen for that whoosh, whoosh sound. Once you find it, you can count the rate and check the rhythm, just like you would with your fingers.
And what about other weird findings? Well, if the rhythm is irregular, don't take a shortcut. You have to count for a full 60 seconds. If a pulse feels weak or is just gone, immediately start looking for other clues. Is the skin cool? Is it pale or bluish? And here's the golden rule. Anytime you find something outside the normal range, you have to report it.
And we'll end with this question for you to think about. Checking a pulse isn't just a task you check off a list, it's a clue. How does that weak pedal pulse connect to your patient's history of heart failure? How does their fast heart rate relate to the fever they're running? This is where you start thinking like a nurse.
We really hope this explainer helps you feel way more prepared to nail this skill. To help you even more, we've dropped some links in the description to our summarized NCLEX revision docs. They are an awesome resource for all of your nursing courses, so be sure to check them out. Thanks so much for watching,